Podcast 5, Supporting Residents with Dementia with Personal Care. Receiving assistance with washing and dressing can be a difficult experience for anyone. Although a care team undoubtedly have a responsibility to make sure that a resident is able to live well with a good standard of personal hygiene and cleanliness, it is essential that care workers are always mindful that allowing others to help with such private care can be a very difficult experience for some residents because of, or even despite, their level of cognitive impairment. Knowing a resident's preferences for washing, for example a bath on an evening, a shower once a week, or standing at the sink to have a daily strip wash, is a vital starting point, particularly if the resident is not always able to verbally express their wishes. If a resident is reluctant to accept help with washing or bathing, or finds changing into clean clothing a difficult or distressing experience, the care team must work together to consider any underlying reasons. For example, the resident may always have been a very shy and private person, not even letting their family see them in a state of undress. The resident may only have been used to changing their clothes on a weekly basis. The resident may be embarrassed, confused, or frightened as to why a stranger is offering to help or trying to remove their clothing. The resident may also be experiencing upsetting reactions due to the memories of a previous traumatic experience. Even if a reason is never established, knowing that personal care is a potentially distressing experience means that the whole team must continually look for ways of making the experience more bearable and less distressing for the resident to ease their anxiety and levels of stress. The team must always work together to identify ways to work with the resident that is more tolerable. For example, making sure that life story information is understood to make sure that the care plan reflects the resident's preferences and preferred routines. Ensuring wherever possible that care workers of the same or opposite gender provide support if this is a resident's preference. Making sure that all staff are aware of a resident's previous experiences so that they understand why personal care may be so difficult and can work together to support the resident to minimise distress. Making sure that the bath or shower room is warm, inviting and feels safe, for example, by making sure there is a screen around the door in case someone accidentally enters the room when the resident is undressed, by removing non-essential clinical equipment such as weighing scales and spare hoists, by adding relevant ornaments to all other objects of interest to lessen the clinical feel of the room, and by ensuring that the resident's preferred toiletries and plenty of warm towels are already in the room. Thinking about clothing, it is important that wherever possible, the type of clothing and style of dress of a resident remains as far as possible as they have always preferred. For example, a gentleman who has always worn a shirt and tie with formal trousers may find wearing jogging bottoms and a sweatshirt to be a very demeaning experience. Similarly, a female resident who's always worn a bra and tights may find it embarrassing and uncomfortable to wear a vest and knee-length stockings. Other points for staff to consider include knowing the resident's preference for toiletries, for example a favourite brand of soap or shampoo, understanding how a gentleman prefers to shave, for instance a wet shave or with an electric razor, appreciating whether or not a female resident has previously preferred to remove facial or other body hair, and whether a resident has previously had a skincare routine or used cosmetics. For some residents, accepting help with personal care will never be a comfortable or positive experience, regardless of how hard the care team work to make it less distressing. Advice should always be sought from a more experienced dementia care practitioner, and force must never be used to make a resident accept help. The Reconnect Manual offers detailed information and guidance to care teams on all aspects of supporting residents with dementia to live well in Avery care homes, and should be referred to by all staff in the care team.